Butt lifts, upper arm lifts, and lower body lifts. When it comes to our physical appearance, these are some of the fastest growing procedures that we are having done, apparently. So what should you be asking your plastic surgeon to make sure that they are safe and the right one for you? With us this morning, we have Dr. Barry Martin, Avera plastic surgeon with the Avera Medical Group, Plastic and Reconstructive Surgery. How are you?
Fine, thanks.
Good.
How are you?
I'm great. Thank you for coming in this morning.
Sure.
You know, there was a recent case in the news this week of a botched procedure, and so this kind of brought our attention to it. But there are an increasing number of people continually considering some sort of a procedure. So what are you seeing or hearing here in the Sioux Empire?
Well, I think we're a kind of a growing metropolitan area, becoming one anyway. So, with the advent of media, procedures are kind of broadcast on all kinds of media. Patients who want to either improve their looks or form are looking to have something done. And again, I think the ownership is on us as plastic surgeons to make sure that we pick the right procedure for the right patient, and it's all about safety too. So that's our job, to take care of patients and be safe.
So I looked up some of the statistics yesterday, and the ones I just mentioned were some of the fastest growing procedures, it appears. What are people typically having done here locally? Well, is it kind of the same?
Sure, it is. I think we mimic what happens across the country for the reasons I mentioned earlier. People that want to have a youthful more appearance that matches how they feel, because people are getting fitter. Again, they look towards cosmetic procedures to kind of achieve that goal. And that can be anything from non-invasive injectable fillers, laser treatments, to more invasive operations.
Okay, so we have some important questions. You're saying do your homework before you go with anyone. The first question you say, how many times have you done this procedure? So, I mean, really look into the background of whoever you might be considering going with?
Absolutely, and I think the first, second, third questions should be asked. Are you board certified in this specialty? Because there's all kinds of people out there doing all kinds of things, and the most important thing is to say, are you board certified in plastic surgery? The American Board of Medical Specialties recognizes 24 different specialties that ensures competent training, maintenance certification as they kind of proceed in their career, professionalism, and again, that's a board certification process, and that's the most important thing to start with.
Know the risks, ask for before and after photos, type of anesthesia, and we're running out of time really quickly, but why is that an important question?
Well, because it's all about safety. So there are certain things that can be done easily in an office-based setting under a little sedation or local anesthesia, but for bigger procedures that involve general anesthesia for comfort and safety, that should be done probably in a more specialty setting like a hospital. All
right, and obviously you want to know the cost. Dr. Martin, it's been great having you in this morning, and
Absolutely.
I actually would love to have you back in. I know that it's just, you're confronted even with some of these options in the dentist office anymore. So it's very, I think, in everybody's face, and it's just good to have a little bit more information.
Good to be